I'm joined by Dessire Santos, Manager of Patient Access at Orlando Health. Desiree is a panelist at our upcoming patient access meeting where she joins a session on aligning pre-service operations. During that session, we'll talk about aligning registration, eligibility, and scheduling to ensure the right access to the right care at the right time. Desiree, thanks so much for coming on today and welcome. To get started, could you share with us a little bit about your professional background, how you got your start in the healthcare industry, and some of the roles that you've enjoyed so far?
Much for having me today. I had a passion since I was a little kid with healthcare, and I actually wanted to be a doctor. That was my goal. So I studied in the university with biology, and then I got some interested in becoming part of the technical team at the hospital. So I went for radiology technologist, and I worked at a few hospital private offices. And while doing that, again, I got interested on admin area. So I jumped in between front desk, referrals, some customer service, what I was doing, x-rays as well. And diving into that got me to pursue then administration, like healthcare administration. While doing that and while doing healthcare administration, I moved to Florida. I'm from Puerto Rico, and I did understand that I needed to do some networking since I was new to the area, and I did a lot of networking during that time. I finished school, and then I got a job as a manager. Well, when I was going in school, I also worked as a referral coordinator, front desk. One of the doctors gave me the opportunity to become a supervisor of his 3 offices. So that's how I ended up now being in Orlando Health and being part of the patient access manager for the orthopedic group.
Perfect. And tell us a little bit about some of your key priorities at Orlando Health. We have you joining our panel on aligning pre-service access operations, where we're talking about registration, eligibility, scheduling, and really aligning all of those important pieces. What are some of the key priorities for your group related to that as we look ahead into 2024?
Sure. So of course, it's access. That is one of our priority here. And when we say access, it could be very extent of what actually we need. So insurances is always one thing that is a challenge every year, every month. Um, Fortunately, we do have some sources that we use to verify eligibility for our patients and making sure that we educate them on what they need in order to have their appointments and, decrease the issues of getting those financial responsibilities back to them. So that is one of the top or the priority here at the Access Center, which is more likely making sure that we do have a contract with that insurance in order to see that patient. And if not, we also educate the patient like this is other options. Having that list of options is extremely important, at least for our access center, because the patient is looking for care and we do care, right? So we want to make sure that they have that opportunity as well, and maybe not with Orlando Health, but any other provider that would take that insurance. So we keep a list to our staff here in order for them to provide options as well. So those are the things that we are working on. Most likely phone systems, making sure the phone is working well, that we are fully staffed, and if not, able to provide that support for the team to also make sure that the patients have no long wait times on the phone, because that's not a good patient satisfaction.
Absolutely. And it's really, like you said, we're trying to ensure that the patients get access to care, whether it's at Orlando Health or somewhere else where their insurance might be accepted. It's really hard to balance that and also provide at the same time a really high level of customer service. Such an
Correct.
important combination. Tell us a little bit about what you're looking forward to talking to your peers about during the upcoming panel. Anything specific you're looking forward to benchmarking?
Sure. Um, I do have questions, or actually, I'm eager to learn more of what other companies are doing in regards of patient access. We're very into our phone systems, our registration system, online access for patients to do appointments, referral self-bookings. But what else are other offices or companies are using for into the technological aspect to ensure that the patient gets some access? Because it looks like this is what is the feedback from our patients. Like access is not that easy or it's a not there. And even though we can be a very huge company and we do have a lot of specialties of family medicine and a lot of things within our organization, patients are not aware of what we have to offer. So I'll be very happy to hear about what other companies are offering or what they have in mind or what are the projects in
Super. And
this
I think we have
aspect.
a lot to talk about that. We've got people talking about different contact center technology they're using, different patient engagement tools, everything from digital front door to, sorting out collections on the back end. There's a lot to talk about. And we're really excited to have you joining the panel. And we're looking forward to the meeting in February.
Perfect. Thank you so
Thanks.
much.
Thanks so much for coming on and have a wonderful day.